Ka Bethany Hospital Shillong rengkat kejingit Trailang bat ke Madras Institute of Orthopedics and Traumatology nek MIOT International Hospital Chennai. Hak arterik jemang arhajar arpuar kela pentip bekla Sdang ya ke Spine Consultation Camp bat kanie kan ya jaduk kahnyu terik mentau benai jemang. Habakaran ikilat petai kubor unong aktien ke Bethany Hospital u Dr. Kentiu Langsan Miet ulong bagajing temu ban pendelong ikan ke program kan long ban ai ke Jingsumar ke babiang syakitu ke badan Jingsumar hau Budlum. Bat kipat ba ikla ban yo ke jingnya selok nak doktor Kiba lepen tebet hakan ke liang nak ke MIOT Hospital Chennai. Ulong bagajing pang hau Budlum ke gajing pang ke bakta ya ki babun bagi beriau mentar. Bat kat kum kejing wat banyak, kindan kum ba kendai pesan nak sispa aki beriau ki ban syakta kejing pang hau Budlum. U Dr. Chetan Sashikan Pophale jong MIOT International Hospital, ulong bagidan bon jat ki rukompang ki belak ban kata ayu Budlum. Bat kejing sumar ke long hendrupau hadu nyu pau nak sispa. Bat kum balai pau nak sispa ke syong honong syak sumar ha ke baudan kam ban kilan met. Bat MIOT Hospital ke lebu ekawai ke Rehabilitation Center ha keba kinong pang kila ban le ya ke badan kam. Ulong ru bai kijat jingpang kiba la ban sumar shillong la ban le kata hangne. Hendrai la ka jingpang ka kam jur an batha kinong pang banat pha sumar ha ke MIOT Hospital.
We already know that almost 9 out of 10 people suffer from back pain once in their lifetime. Okay, and we lose a lot of days of work because of the back pain. There are a lot of conditions which are related to back pain which cause pain in the legs or weakness in the legs, or there are some pain in the neck which can cause paresthesias in the hand, or it can cause paralysis in the upper or lower limbs, that means in the hands or in the legs, or people can also lose their control of passing urine or motion because of speed, and nowadays because of the high speed vehicles and all, we can sustain trauma to the spine that can lead to injury to spinal cord, which can be catastrophic. Because of that, there can be injury to spinal cord and subsequently loss of power in both upper and lower limbs as well. And there are so many myths related to spine surgery, that once you do spine surgery, you will be disabled, you will be forever bedridden, you will never be able to walk again, you will be always having pain. So I'm just here to clear those myths. At MIOT Hospital, we specialize in spine surgery. We do everything related to spine. We manage all aspects of spine disorders. We manage non-surgically, we manage surgically. If it comes to surgery, from minimal invasive surgeries, we do endoscopic spine surgeries as well. Also, a lot of young kids, they suffer from bend in the spine. We treat those bend in the spines as well. After the surgery, a lot of people require rehabilitation. Surgery is only 60 to 70% of the job. Remaining 20 to 30% job is to rehabilitate the patient after the surgery. So we have started with a rehabilitation center where we rehabilitate the patient as well.